Hello, how are you all? Thank you so much for joining us in this virtual Homecoming 2020 event. My name is Antonia Maioni. I'm Dean of Arts here at McGill University. And like many of you, all of us here at the faculty have been dealing with the fallout of the COVID-19 pandemic. It's touched every aspect of your lives. It's touched every aspect of our lives here at McGill University. But the other thing that's been happening in the wake of the pandemic is the faculty itself has been responding by transferring all of our teaching to online. This fall, we are a virtual university in many ways, and especially in terms of our teaching offerings. However, the other part of COVID-19 that you may not be aware of and its impact on the Faculty of Arts has been the contribution of many of our researchers in trying to understand the origins and the impact of COVID-19 and how it is affecting not only our health, our healthcare systems, and also our economic and social lives. It's also having a profound impact on politics and policy in Canada. So this afternoon, I'm very happy to have joining with me two researchers and professors from the Faculty of Arts, Professor Delphine Collin-Vézina and Professor Danielle Béland. Professor Collin-Vézina is a very distinguished researcher, and she holds the chair, the Nicholas Steinmetz and Gilles Julien Chair in Community Social Pediatrics. She's affiliated with our School of Social Work, and she directs the Center for Research on Children and Families. She's also someone who has done extensive work on vulnerable communities, youth in particular, and families. And of course, these vulnerable communities are even more exposed to the impact of COVID-19 on their lives. I'm very, very happy to welcome Delphine Collin-Vézina with us this afternoon. Our other speaker conversation this afternoon is Professor Danielle Béland. Danielle is director of the McGill Institute for the Study of Canada. He's also professor in the Department of Political Science, which is also my home department in the Faculty of Arts. Professor Béland is someone who is no stranger to politics and policy. He is someone who's worked extensively in the field of social policy, Canadian politics, and federalism, and you may recognize him from his many appearances on the media trying to explain the complexities of political life to Canadians. Both of these speakers, I think, are going to be a great way to guide us through some of the conversation today on the impact of COVID-19 on our economic, social lives and our communities here in Canada and beyond. So let's get started. I have a number of questions that I am very much happy to share with our two panelists. Let me start with a big question. And the big question today, I think, that we'd like to know from our two distinguished researchers is, from their point of view, what is the most striking way that this pandemic has affected Canadians? It's affected us in so many ways. And we have been in social isolation, we've been coming in and out of quarantine, but what is the way that you feel is the most striking way that COVID has impacted on our lives as Canadians? Let me start with Professor Collin-Vézina. Delphine.
So thank you very much, Antonia, for inviting me to join this virtual homecoming. It's really a delight to be joining you on this very important initiative. So to respond to your question, as you know, my expertise is on children, youth, and families. And so it does influence the lens through which I think about the impact of COVID in our lives. And what is striking to me is that when the pandemic started, children, youth, and families were probably not very much on the radar in the same way as other populations most impacted by the virus in terms of health consequences were. Then schools and daycare settings, they remained closed for a longer period than what we anticipated in the first place. And we started worrying about the impact of the pandemic on children and youth well-being. I probably can say that for many families, and especially families that have different privileges in terms of capacities to fulfill all their needs and who have good psychological, mental health status, who were not personally touched by the disease, the consequences might be very minimal. Maybe they were anxious about the pandemic, maybe they were frustrated by the confinement and isolation public policies, and that was especially the case for teenagers. And many families, they were voicing how much they were lacking personal space, because we were all together in very small places without the usual activities that keep us very busy. But there's also a scholarship that is showing that in other pandemics, for instance, H1N1 and SARS epidemics, there was an important proportion of families who were really not doing well. They were in great distress. Members of families were displaying increased depression, anxiety, and even post-traumatic stress disorders. And unfortunately, the studies on COVID-19 that are just emerging, they're also confirming similar trends. So we now have quite a good scholarship confirming that there's some families that are really experiencing very severe negative impact due to the pandemic, and especially with regards to children and youth mental health and family functioning. Of great concern is the fact that we have evidence of high rates of divorce and separation due to the pandemic. And we also suspect that there are higher rates of maltreatment and family violence. So I think that for me, what really stands out is the fact that there's clearly a range of outcomes. There's a continuum of reactions and impacts, and not all families will be impacted the same. And therefore, our practices and policies, they need to be designed to respond to this range of needs.
Thank you so much, Delphine. That's a sobering portrait, but a very real one of some of these impacts on families, and in particular, vulnerable families and vulnerable communities. Danielle, what would you say is the most striking way that you've observed the impact of this pandemic on Canadians?
Well, at the most general level, I think the everyday life of Canadians has been disrupted in a major way. But there are major discrepancies if you look at different groups in society, not just age groups, but also ethnic groups, gender categories, and so forth. And I think it's very important to keep that in mind. That crisis, they don't erase existing social institutions and structures. They often exacerbate existing patterns of inequality, existing vulnerabilities. A population in Canada that has long been perceived as vulnerable is, of course, older people. So I can use this example as a counterpoint to Delphine's discussion about young families. But certainly, in terms of the casualties, people who have died of COVID-19, older people, especially older people living in long-term care facilities, have been the main victims of COVID-19. And this has, I think, not just exacerbated our concerns about the well-being of older people and their vulnerability, but also has reshaped the policy agenda over long-term care in this country. We already knew before the COVID-19 crisis that there were major challenges with long-term care in this country. In many provinces, the problems were, documented in different reports, official reports, and in the media. But what we have seen since the beginning of this crisis is growing public and political attention towards the future of long-term care in this country. And this is not just about public health, but about public policy more generally. It has a major fiscal federalism aspect to it because of the nature of our funding system and the Canada health transfer and how it works. So certainly, the crisis is creating new policy challenges, but also making more apparent challenges that existed before the crisis. So this crisis reveals to a broader audience challenges that already existed before it took us by surprise earlier this year. And that's important to keep in mind. COVID-19 is helping us better understand Canadian society because it reveals so much about our society that was sometimes a bit outside of the public's view, or that was not widely debated within policy circles or in the media. And now we have that revealed in a very dramatic way. In this specific case, the really major challenges facing long-term care facilities in Canada.
Thank you, Danielle. Delphine, reflecting on Danielle's comment about, in effect, COVID ripping off some of the barriers and showing us some of the challenges that already existed. Tell us about some of the vulnerable communities that you work with and what the pandemic has taught you and your researchers about how they live and how Canadians should know more about the impact of this on their lives.
So I completely echo Danielle's point about how vulnerable families, the COVID-19 crisis has just exacerbated social and economic inequalities that were already present before. So what is clear is that vulnerable communities are probably more vulnerable now than ever before. And the thing also to consider is that there are new families, if thinking about children, youth, and families, there are also new families that are falling in this category. If we think about those who were in the working poor socioeconomic status category and parents have lost their job, they might be quite vulnerable now. They might be relying on food banks for the very first time in their lives. They might be finding themselves in very precarious situations in terms of housing and in terms of accessing other necessities. So this is really concerning, and we need to pay attention to this as a society. And just even at the global level, the UNICEF is estimating that the pandemic will increase the global rate of child poverty by 15%. And so this impact is devastating for the people right now, but also the generation of children who will be at the next generation of adults. In your question, you were asking about my work in particular. And so I work with a very vulnerable group of children and youth, those that are exposed to and subjected to family violence, and so especially child abuse and neglect. And so my research work primarily involves child protection services, those that respond to cases of child maltreatment. And we know that school systems are a major source of referral to child protection services because they connect with children on a daily basis, because they establish very good rapport with their students. And so when the pandemic started, I was extremely worried about abused children that were no longer looked after due to the confinement and school closure. And unfortunately, the study that we undertook really confirmed that worry. In Montreal, there was a third less referrals to child protection services in spring 2020 in comparison to the spring 2019, where COVID was not in existence. And that was directly attributable to fewer referrals made by school personnel. So thinking about vulnerable populations and my research work, for me, what that means is that there were many cases of child maltreatment that were undetected. And that means that the needs of children and youth were unaddressed. So what I think, for me, what stands out is the fact that when we're facing a pandemic situation such as the COVID-19 crisis, it doesn't only have very severe health consequences, but also profound psychosocial impacts.
Just as we're seeing these kinds of tensions growing and some of the social supports and social structures in place being frayed to allow us, for example, to be able to help vulnerable families and children in particular. Danielle, what are you seeing about some of the impact on the fraying of our, I don't know how to put it, but our whole political community? Are you seeing the same kind of tensions that may not be as tragic because of their impact on individuals, whether they're adults or older Canadians or children? But what are you seeing in terms of how this is having an impact on our political communities?
Yes, thank you for the question, Antonia. So we obviously live in a federal country, and we have, first of all, regional discrepancies in terms of the very impact of COVID-19. We also have a situation that's quite exceptional, and I have to say that if we compare Canada to some other federal countries like the United States or Brazil, we have seen a growing sense of solidarity and collaboration at the intergovernmental level. There was quite a bit of conflict and bickering, like is usual the case in Canada in normal political times between, say, premiers and the prime minister and so forth. But what we've seen since March is actually an enhanced level of collaboration and discussion and coordination among different levels of government. And I think that's something that we can contrast to what we see in other federal countries like the United States, where there is a lot of partisan conflict that is really affecting intergovernmental relations. So I think that at least temporarily, some of the intergovernmental conflict have moved to the backstage, and they are less intense. But these conflicts, of course, are and will re-emerge as we are talking more and more about how we pay the bill and who will pay the bill. Who will, finance all the programs that we have created or we need to enhance in the future? So fiscal federalism, which is a major source of intergovernmental conflict in this country, is likely to move again to the front stage. And so it's not that our differences and the tensions have disappeared, but in that case, I would say that they have decreased temporarily because of the need to work together. And I think it was done quite effectively at an intergovernmental level. And that's something actually quite positive that we have witnessed during this crisis, at least when we compare to what we've seen in other federal countries.
So speaking of policies, which are going to be very important, which have been very important in responding to the pandemic, but now as we are in another phase, which is more of a long-term phase of how we respond and try to not so much live the new normal, but to think about how we deal with this crisis and try to prepare for others. Delphine, what would you say? What would you say are the resources or policy directions or the advice? What advice would you give our political leaders, whether they're federal or provincial, on what we need to go forward?
Well, I think that what is crucial is to adopt an equity-informed response to COVID-19 that is based on social justice and solidarity principles. It's clear that we won't be impacted the same way, and we must pay careful attention to populations that were already experiencing different levels of oppression and marginalization, and those who have fewer resources to meet basic needs due to COVID-19. And so thinking about the Canadian context, I think it's really important to recognize that there have been years of oppression and policies and that have created a clear disadvantage for certain groups. I'm thinking about racialized families, Indigenous families, other marginalized groups. And we need to fully acknowledge that these past and present policies and practices, they've had a tremendous impact on the disparities that certain groups experience. And so the COVID is just exemplifying these disparities. And so there will be some families or communities that will take longer to recover from the pandemic. And I think we need to think about programs that will support them, not only short term. I'm thinking about parents who have lost their jobs or children who are lagging behind in their learning because they did not go to school for 6 months, which is just such a long period of time for children who are already struggling. They may have learning disabilities, or they may just have a difficult time at school. And so these impacts will not get resolved very quickly. But as a society, I think that we must have the courage to invest in this, in the well-being of our population so that everyone can thrive. And even if it looks very expensive in the first place, and I agree that with Danielle, that eventually it will be about who's paying the bill. I think it pays off if we eventually have programs and policies in place to increase employment and school graduation and mental health, and that it will be just to the benefit of all individuals, but also to families and communities.
Well, Delphine's given us quite a list of challenges ahead to be able to respond to COVID-19 in a more long-term way, in particular for the kinds of vulnerable individuals and families in Canada. Danielle, do you think our political leaders are ready for this challenge? Do you think that we have the policies in place or can get the policies in place to be able to respond in a way that is not only sustainable, hopefully, but also has the desired impact?
Yes, I think that there are major challenges, but as I said earlier, we saw during this crisis that people can work together facing this difficult situation. I think that we can learn from each other. For example, a lot of our social policies are based in the provinces, and certainly there is room for provinces to learn from one another. For example, in long-term care, I mentioned long-term care for older people. Quebec is not doing so well. We saw this during this crisis and before, but New Brunswick, for example, is doing a much better job in many ways. So we have to learn from one another, and that's an advantage of federalism. Some people talk about, federalism as a laboratory of democracy or laboratories of democracy, the different provinces, territories, even at the municipal level. And I think it's time to really look at what people have done well and not so well during and before this crisis at the provincial level, and then try to draw lessons from this. As for the federal level, we are in a context of minority government, and there are obviously tensions. At the same time, I think that when, let's say if there's a second wave of COVID-19 or the level of emergency increases further, I'm confident that people will find some common ground to tackle the issues that we face as a country. And what we saw at the beginning of this crisis in late March, in April, in May, shows us what can be done when collaboration is not an option, when it's a necessity.
So Danielle, that collaboration in effect, people's willingness, right, to come together and to help defy this pandemic, or at least to respond to it, was really important. But we're seeing the strains of that, right? We're seeing some of the social fabric that is making that more and more difficult. And not only in Canada, but really across the world. Debates about the wearing of masks, debates that are happening right now about reopening schools, reopening universities. Delphine, how are we doing in a global sense? How do you see Canada's response to COVID? And in particular, in terms of the work that you do, how do you think that we've been responding compared to other countries?
Well, in my field of study, we were all taken by surprise. So already working in a field that is, tackling a very difficult subject and working with very vulnerable populations, and with, in many cases, not all the resources that are in place to respond to all the needs that are present in these families for children and youth. And so if we do collaborate, so this is really just, I think we all took it as an opportunity to bring all forces together. We have international collaborations, so child protection, child welfare, researchers from around the world. And what we did at the very beginning was to sit with our Italian colleagues, because they experienced the crisis to a very great extent, and trying to learn from them. And I think that as researcher, what was very exciting and really clearly a window of opportunity was to sit with practitioners, decision makers, and also to be part of the dialogue and try to see how we can continue to provide the best services possible, despite the fact that we cannot see families, children, and youth in person, that we have to provide telehealth services, and to build the best practices despite this very important moment we were facing without clear guidelines. So really, if I have to say just one positive aspect, is that I think that it brought us together to face kind of a common enemy.
That's a wonderful sentiment. Shows the power of research and McGill's role in that research as well. Danielle, you study welfare states, and welfare states are often a reflection of how resilient different societies can be to challenges, whether they're economic, social, or political. What do you think in terms of Canada's response or Canadians' response? Has our welfare state shown some resilience compared to other countries?
Yes, so I'm co-editing with some colleagues from all over the world a special issue of a journal called Social Policy Administration on the social policy responses to COVID-19. So I've already read some of the scholarship and comparative scholarship. And I think that Canada, considering the limitations of our federal system in terms of short-term policy responses, I think was quite fast to respond in terms of creating temporary emergency social programs. And I think that this was done really fast. Of course, a lot of improvisation and some mistakes were made, obviously. But at the same time, the federal government took the leadership in April, especially in May, to create these new programs. The problem is that these are temporary programs, and now we have to think about some of the flaws that were revealed by this crisis that are not just temporary, but are permanent. For example, our employment insurance program, our federal program, was already flawed. The flaws were quite obvious to experts like me and others, but I think now we know that we need to look into, and we are doing it right now, to look into employment insurance and try to make it a more effective program that actually covers a majority of people who are unemployed, which was not the case even before the crisis. And that's why, of course, the federal government had to create emergency measures because EI was so flawed. And I think that we need to look at ourselves in the mirror, compare to the experience of other countries, and think about how this crisis can be used to draw lessons and improve our welfare state permanently beyond the temporary measures, which in essence will be probably gone within the next few months, but are only temporary. But I think we need to fix some problems that have been around for a long time and that have been exacerbated or revealed by the COVID-19 crisis.
So both of you have done a lot of research on your own expertise and with your collaborators, whether here in Quebec and Canada and across the world. But more generally, what's the role of an academic institution like McGill, a very research-intensive, very internationally focused academic institution? Do we have a role in helping to shape a post-pandemic world, either through the research that we do or the training that we do, how we in effect build research capacity, but also train the next generation of future leaders? Delphine?
Yeah, I hope so. I think this is what the driving force is for us in terms of being committed to the work that we do, being involved in so many different projects, and really trying as much as we can to represent McGill through different projects, through different collaborations. I think McGill is an amazing research hub where new knowledge is discovered every day across disciplines. And in a time of crisis, such as the one that we're facing now, we must rely on science to inform our decisions. And I think that McGill is playing really a leadership role in that regard. And I feel fortunate to be contributing to this with all my colleagues. And we also train dozens of students every year, and they will become professionals, they will become practitioners, educators, scholars, decision makers, and leaders. And I think that all the McGill alumni, they're represented in all sectors in our society, and they can really play a vital role, and their contribution is invaluable here in Canada and internationally.
Danielle, would you agree? And how do you intend to take this and run with it, if you will, in terms of your own research and teaching?
Yes, thank you very much. I totally agree with Delphine. I think that, so as the director of the McGill Institute for the Study of Canada, of course, I have organized and we will organize events addressing the COVID-19 situation, events that bring together people from different walks of life, academics, government officials, members of the public. And so it's very important for us as a university to engage with society more generally, to engage with policymakers, to engage with citizens. And I think that this is what our institute is doing. This is what a lot of other institutes and schools and departments are doing across the Faculty of Arts. I can mention, for example, the McGill School, which has also done a lot. Our School of Public Policy, recently created, has done in terms of really shaping the debate about responses to COVID-19 in this country. And we have also other units on campus in other faculties, like the Institute for Health and Social Policy, that has also played a major role, I think, in shaping policy debates about the post-COVID-19 world. So I give just a few examples here beyond even the realm of medical research per se, because McGill is involved too in vaccine research, and there is this global race to find a vaccine to COVID-19, and McGill is a top-notch institution in terms of medical research. But in terms of social science, research, we are also a top-notch institution, and across the Faculty of Arts, we have people in many different departments, units, schools, institutes, who are thinking about the challenges we face as a country and the challenges that the world face. And I think that together we can engage with the broader Canadian community and frankly the global community to really address the shared problems that we face.
Thank you, Danielle. That's a great shout out as well for your colleagues across the university, but also in the Faculty of Arts. And just as Delphine and Danielle have shown, there's a great richness to the research and teaching that's done in the Faculty of Arts that has a role to play in shaping a post-pandemic world in the way that we train our students, are moving to virtual. The virtual teaching has been a great challenge for our professors, but also for our students, and they've taken it up with a great amount of resilience and confidence. But also the other research that's being done. We've seen today how it does go beyond medical research. It is about how the pandemic affects families, vulnerable communities, senior citizens. It affects our political fabric as a country, and it affects the resilience of our social programs through the welfare state. Other researchers in the Faculty of Arts are looking at the economic impact of COVID-19, about the economic response to COVID-19, how it's affecting the future of markets, how it will affect the future of many economic decisions. We're also thinking about more of the philosophical issues that have to do with ethics and the role of the state versus society in compliance and other impacts of the COVID pandemic. We also have looked at how the origins of pandemics such as COVID-19, we have an historical record of it, and how historically societies and governments and leaders have responded to it. So it really is, it's been a shared experience for all of us in this academic setting, but it's also a very rich area for us as social scientists, as workers, as knowledge workers, as people who are training the next generation of leaders, of social workers, of other professionals, to be able to bring our knowledge to bear on these outstandingly complex and difficult issues. So I'd like to thank our panelists this afternoon. It's been a terrific conversation with Professor Delphine Collin-Vézina, who's Director of the Center for Research on Children and Families, the Social Work at the Faculty of Arts at McGill University, and also in the Department of Pediatrics, where she holds the Nicholas Steinmetz and Gilles Julien Chair in Community Social Pediatrics. Thank you very much, Delphine, and best of luck in your work with vulnerable families who need, of course, all of the expertise and all of the knowledge that we can bring to bear on this situation. I'd also like to thank Professor Daniel Béland, who is Director of the McGill Institute for the Study of Canada, as well as a James McGill Professor in the Department of Political Science. He is, as we've seen, a specialist in social policy and also in federalism. And I hope, Danielle, that your collaborative research will also bring us some insights into how we respond to COVID-19 from a political and policy point of view as well. Thanks to all of you who have joined us for this Homecoming 2020 event. It's been virtual, but it's also been it's been a wonderful and virtual pleasure to have you with us and to engage with these two brilliant members of our Faculty of Arts. Thank you so much.